Optimal health for high performers. This is the Health Upgrade Podcast with Dr. Nawaz Habib.
Welcome back to the Health Upgrade Podcast. This is Dr. Habib. I am here with my co-host JP and with our wonderful guest today, Dr. Eleanor Stein. Dr. Stein, Eleanor, it's wonderful to see you again. We've had some wonderful connections in the past, and I'm excited to reconnect with you and learn more about the work that you've been doing more recently in neuroplasticity, which is a topic that JP and I are very, very interested in, have spoken a little bit about, and we're really excited to dig into it further with you.
Yeah, thanks for the opportunity. I'm really looking forward to digging in with both of you and see where this goes.
Absolutely. You are an MD initially out of the west side of Canada, and having come up in Canada and the Canadian healthcare system, you have a specific view on kind of how things have worked in the conventional system, particularly in the Canadian system. But I'd be really interested to hear about some of the learnings that you've had in working with clients with complex chronic diseases and how it's transformed what you think about in regards to neuroplasticity as well, and how people can improve how their brains are functioning. We'll get into all of that as we go. Let's talk a little bit about what neuroplasticity is, and why don't we have you give your take on what neuroplasticity is and how it affects how we think, how we feel, and how we act. I think that would be really a great place to start.
I think we're already speaking from the same hymn book here, Nawaz, because those are the exact words I use. So we all have brains. So the first message is, everything I'll say today is really applicable to everyone, whether you're someone who has a very severe chronic disease, even a bedbound or housebound person. This neuroplastic practice is available to anyone because you could be lying in bed doing it, right? You don't have to be up or running or eating or something like that. It's applicable to the average person who wants to upgrade their health in certain areas. And then it's also applicable to really high performing people who want to just further tweak or fine tune something that they're working on. So neuroplasticity is defined as the change in the structure and function of the brain as a result of lived experience. So I'll just kind of deconstruct that a little bit. So the structure means we've got neurons and they meet. I'm sure all of your listeners are super familiar with this, but just maybe for the new person who's just joining today, and they connect with each other through synapses, which are physical places where little branches coming out from the neurons almost, but not quite meet. And neurochemicals go across that synapse and kind of facilitate the movement of information throughout the brain. So all the time, like every moment of every day, we're having experiences, and the experiences hardwire like a remnant of what happened. So the law of neuroplasticity is what fires together, wires together. So like right now, we're all listening. I can see you nodding. I'm like, okay, that's good. They're with me. So all of these thoughts, feelings, and experiences I'm having right now have the potential to hardwire. So then you'd say, well, probably not everything could hardwire because we just don't have that much room in our brain. We've got a lot, right? We've got 100 billion neurons, and each one of them has these synaptic connections with 10,000 other neurons. So we're talking super big numbers, but nevertheless, it's not infinite. So how does the brain decide how to spend resources? Because to make synapses and fire together costs energy. And they decide that based on what happens most often. So if I do the same thing over and over, my brain is going to go, aha, I get it. There's a pattern here. I'm going to lay down some more hardware so that this can happen more efficiently and easily. And the second is there a strong emotion? That means it's really important. Neuroplasticity is neutral, right? It hardwires everything, whether it was a positive or a negative experience. And neuroplasticity is in part responsible for the after effects of trauma because the experience was so traumatic we remember it, right? People can say, yes, this happened when I was 7 and I remember it like it was yesterday. That's an example of neuroplasticity with a strong emotion that laid that down as if it was in stone. We can use that quality or aspect of neuroplasticity to our advantage by creating positive emotions, elevated mood, so that when we practice the new habits and behaviors that we want to lay down, they're going to have a better success rate.
Now, Dr. Stein, help us understand, help our audience understand what mechanisms or what cells are involved in the creation of those synapses and the decision as to whether or not a synapse should be strengthened, which generally means long-term potentiation, versus have it be removed. And we know that that connections that aren't needed get removed from the brain during development and all the way through life and even into old age. There's a constant ebb and flow of new connections being made and then connections that aren't being used being taken away. In fact, many of the diseases like Alzheimer's and dementia have this characteristic of an over pruning away of those synapses. What cells, what mechanisms are involved in doing that?
Well, the first thing I'd say is there's kind of an informal law of neuroplasticity called the second law. If you make them, you break them. And if you break them, you make them. So this is kind of the lack of infinite space in how I understand that. So the more synapses you make to facilitate a certain thought, feeling, or action, the less resources, say something you want, like learning a new skill or creating new relationship style or changing your mood, the less resources you have available to, say, have your brain constantly firing up chronic pain and other symptoms. In terms, I think for your question, like at a deeper level, I think of Dale Bredesen's work, where there's like literally these switches in the brain that are either on build it or prune it. And I don't have it all in my head, but basically, if our brains are inflamed and unhealthy, that switch is gonna flip to prune, right? To cut back, recycle resources. Well, it just gets the message there's not enough to go around, and we better prune things off to keep what we have. And if we can, so he talks about various types of inflammation, like infection, inflammation from dietary habits, so our whole metabolic disaster. Hormones are very important for that. And stress is very important for that. So all of those, it's why this has to be in the context of something holistic, right? You can't just do neuroplasticity in a vacuum. You have to look at the health of the body and the brain.
Yeah, I think where I was going was that there are on microglial cells, the immune cells that become inflamed, there are chemical receptors and chemicals expressed on those synapses, on both sides of the synapse, the presynaptic and postsynaptic terminals. There are proteins that get expressed. And as the microglia are present and touching the synapses, they spend about just short of 95% of their time doing that. There are signals that they're euphemistically referred to as find me signals and eat me signals or don't eat me signals. And those are the signals that recruit them, the microglia, to do the long-term potentiation processes to strengthen those connections, which actually, that strengthening of the connection actually means reducing the amount of excitation necessary to activate it. It's sort of like we always talk about taking a bike through the woods. You're riding through the woods the first time, and it's difficult. You've got branches you're going over. You've got leaves that are in the way. But by the time you've gone through it 100 times, you've sort of moved all of that stuff out of the way, and you're just riding along on a dirt path that's easy. So,
yeah, I use that same metaphor, right? The more you do something, you change like a goat path into a superhighway. what happens in many of these chronic conditions is, unfortunately, the superhighway is filled with symptoms, right? The brain is in danger mode. Maybe they haven't partaken, Dr. Habib, in your teachings about the vagus nerve. So they're in danger mode, they're in fight or flight. And in that case, the opportunity for neuroplastic change in the direction that we want it to go is less. And it's more likely that people are just going to keep recycling danger.
You mentioned something earlier, chronic pain, and how chronic pain can almost be a negative neuroplastic response within the brain, and people experience pain even though there isn't a specific trigger for that chronic pain experience to occur. But it's a neuroplastic learned response. Is there anything there that you can kind of dig into? Because I know your specialty is kind of in the ME/CFS side of things. I'd love to learn a little bit about how chronic pain and neuroplasticity work together.
Sure. That's a great question. I'm so glad you brought it up, because if people understand, and I'm going to explain it a bit more, that most chronic symptoms, but chronic pain is the field where we have the really hardcore research to prove it. If people understand that most symptoms are actually generated by the brain and not the body, or at the very least, the body with a big influence or input from the brain, then neuroplasticity practice is going to make more sense. If I think that my chronically sore knee is due to my knee, then why would I spend an hour a day trying to change my thoughts, feelings, and behaviors? So when we have an incident, say an acute pain, say I had surgery, infection, accident, childbirth, maybe it could be something even unrelated, like just lack of sleep or some other illness. Most people recover. So in the ME stands for myalgic encephalomyelitis, also called chronic fatigue syndrome. And now we're seeing that long COVID has a lot in common with ME. So I'm going to kind of throw that into the basket. So we know that from prospective studies that about 10% of people that have an initial infection and event don't recover from certain infections, things like Epstein-Barr virus infection. There's like 3 prospective studies showing that. So why do 90% of people recover and go on with their life and 10% don't? And we've got similar figures, looks like in COVID, 10 to 15% develop long COVID. And I don't know the answer exactly why. Some of the things have to do with the expression of all these immune molecules at the time of the initial event. Certain ones seem to prime the immune system to give the brain messages of danger and say, you know what, this is a big problem. We have to start spending more resources and direct more neurons to try to help solve this injury. Meanwhile, 2 months later, the injury, as you say, is totally healed or substantively healed. It's not the cause of the ongoing pain. And the pain is actually the brain continuing to think it's in danger, even when the original problem is solved. When people understand that, they totally buy into this approach. They work hard because they get it. They do really well, and you can have substantive recovery within weeks to months. I'll just give a personal example. So I come to this field not only as a physician, but also as a patient. So I became ill with fatigue, pain, multiple chemical sensitivity, low blood pressure, POTS, orthostatic intolerance, kind of all of those things in 1989. So that's like 35 years ago, something like that. And at that time, of course, we knew nothing. So to get back to comments on the healthcare system, right, we have fantastic, responsive and state-supported healthcare for things that are acute, like heart attack, stroke, liver disease, need a kidney transplant.
Broken bones.
Broken bones, exactly. Great place to live in Canada if you've got any of those problems. But if you've got a complicated problem for which there's not a linear solution, And you have to look, as you do, Dr. Habib, like you're looking at the big picture, right? I've heard you talk about diet and lifestyle and sleep and all of that stuff. Our healthcare system really isn't set up for that. And these people fall between the cracks. So I was working with people already for about 15 years, helping them with, comprehensive self-management when I started learning about neuroplasticity. And what got my attention was one of my most ill patients who was literally living in a tent. Her chemical sense, and in Calgary, that's not a great idea. It's super, super cold. So she was literally living in a tent, so sick, like super skinny, couldn't tolerate any foods, just had all the sensitivities. And she did some brain training workshop and came back like 30 or 40% better in 1 week. And I was like, okay, because I was very skeptical, like how I'm a hardcore biomedical person. I thought these illnesses are clearly in the body. I'm a psychiatrist, so I can tell if something's, biological or psychological, at the risk of making that non-existent duality even worse by mentioning it. And, it was obvious to me there's stuff going on at a biological level. And yet this person got significantly better in a week. So I do what I always do. I signed up for the same program, went there, and my lifelong chemical sensitivity improved within a week also, from like very severe and really limiting the choices I made day to day to virtually non-existent. I don't even think about it anymore. So at that point, I had already read Norman Doidge's first book, The Brain That Heals, The Brain That Changes Itself. Yes. And then the second book was just coming out, like literally at that time, The Brain's Way of Healing. And I just devoured it. I read every reference, looked up, the webpage and information on every person he mentioned. And I came across Michael Moskowitz, who's now retired, but he was a psychiatrist in the San Francisco area. And he had created this, paper manual kind of laying out, he himself had encountered chronic pain, didn't want surgery because he knew his type of surgery was not usually that successful. And as he was, I guess, lying there, not doing much, trying to recover, he just started reading like 10,000 papers on neuroplasticity. So he came up with the kind of the bare bones of the program that I've added onto. And one of the big pieces I've added is calming and safety, right? So the vagus nerve parasympathetic, because as I was working on it with people, I realized for the neuroplasticity to have just empirically to have the best chance of working, the nervous system has to be calm. If you're in fight or flight, that's not the time the brain is going to spend resources on trying to create new pathways.
Yeah, I couldn't agree with you more there. And there's a couple of words you mentioned there, JP, just before you jump in. You mentioned danger and you mentioned safety. And danger has been coming up a little bit. And that danger response, that cell danger response that triggers the immune system, we're finding more and more is the signal to push towards a sympathetic fight or flight state. And that's where more of the pruning occurs. That's where more of the breakdown and more of the catabolic functions of the immune system kick up a notch because they're trying to avoid this danger or this threat to the survival of the person. Where on the polyvagal theory side, we see the exact opposite of danger being safety as the major driver of a parasympathetic, vagally activated immune response that pushes towards that rest, digest, and recover and healing response. Mm-hmm. And that is a really important distinction to put in there, that safety versus danger side of the signaling via the autonomic nervous system to these immune cells that then creates this opportunity for neuroplastic approach and neuroplasticity to occur, ideally in a positive manner and create positive changes, but it can also do it in exactly the opposite manner where we get into a situation like chronic pain or whatnot. So just want to outline those two.
Yeah, this is really the heart of the vagus immune connection, which is, not to promote yet another book, but that's the title of my book, because it's focusing on the fact that what you see in the autonomic nervous system either being in that fight or flight state or in the rest, digest, and restore state is translated directly to the immune system. The immune system doesn't know whether or not that stress is associated with you fleeing from a lion or dealing with the fact that you've got to pull the second all-nighter this week, and you're under a lot of stress at home and at work and, in family life, et cetera. Your immune system will respond either way. And in the central nervous system, what that means is that the microglial cells become activated into a state in which they stop doing the pruning and building of synapses that you want them to. That's why brain fog is such a big part of inflammation. In fact, depression is now recognized as having a cognitive dysfunction as a principal, not just a collateral, but a principal symptom of depression is this cognitive dysfunction. And so what we want to do is want to bring all these pieces together to treat people who are living with either pain or cognitive problems or emotional problems, and show them that there is no, as you said, no divergence between what's happening in the body and the physical things that are happening with your immune system and what you're feeling, what your perceptions are. They're all unified through this what I call a feed-forward loop of you've got neurotransmitters, you've got inflammation, you've got cellular responses. They're all happening together. And if you can regulate one of them properly, that's why sleep is such a wonderful thing. If you can get sleep, it has such a profound effect on all of the levels of pain, emotion, and cognitive function, because you are regulating all of those pieces simultaneously. If you can regulate the immune system, or you can regulate the autonomic nervous system, then you can have a positive benefit around the entire loop. And so the message is that any one of those is beneficial. And if you can if you can hit it with multiple angles, whether it be counseling, whether it be sleep, whether it be exercise, whether it be diet, whether it be vagus nerve stimulation, which is something that obviously Navaz and I are keen on, all of those things can work together to enhance the plasticity changes that you want to go from being in that unhealthy, unhappy state, uncomfortable state into what I like to say is a happier, healthier, and smarter self.
Yeah, no, I couldn't agree more. And Navaz, you mentioned the cell danger response, and I might get criticized for this, but I kind of see, so the cell danger response is when at the cellular level, the cells sense danger, the mitochondria sense danger, and they actually kind of shut down into I call it first gear. They're just surviving, but they're not producing enough energy to be really effective. And we think that in myalgic encephalomyelitis and probably long COVID, this kind of resting or hibernation state is what's associated with the low energy that people perceive. And I like to think to get better, we have to feel safe at the psychological level, but we actually have to do stuff in our bodies to make our cells be safe. Like, we can't fool them. You can't say to your cells, oh, everything's good. That meanwhile, we're feeding them junk food and not getting enough sleep. They're not going to buy it. So I kind of anthropomorphize the cells and the mitochondria and say we actually have to be and feel safe in order to heal.
Yeah, one of the areas that I like to kind of connect here is when we think of safety, we often think psychological safety, but we also need to consider biochemical safety. We need to consider physical safety. We need to consider emotional safety and even bioenergetic safety, right? There's so many different inputs into those cells, and the cells will respond the exact same way under a stressful input. Doesn't matter if it's biochemical or physical or psychological input, those inputs are driving that response. So we need to create safety in all aspects in a holistic manner in order to not trigger that cell danger response. So I think that's kind of how I see it.
Yeah, I love the fact that you bring up mitochondria and energy, because I think it's one of the four fundamental forces of life. and that you manage your energy properly and you create your ATP in a efficient manner. If your mitochondria aren't functioning properly, it has detrimental effects on perpetuating inflammation. It has effects on your epigenetic controls for protein production and expression and other things that are really critical to functioning normally. I realize that I might be putting you on the spot, or even just, sort of putting you in a place where you have to think about something you hadn't thought of before. Mm-hmm. Maybe not. But what do you suggest, or what do you incorporate into your treatment paradigms around getting your mitochondria to be more healthy? I mean, are you looking for, autophagy, mitophagy to trigger it using fasting techniques? Are you looking at, uncoupling the mitochondria, sort of the way, there's Stephen Gundry out there is talking about the importance of that with respect to your metabolic health, or are there other things that trigger mitochondrial biogenesis that are good? Obviously, exercise is a wonderful thing, and movement is a wonderful thing. But what else do you suggest patients do in order to attack this problem from the metabolic standpoint?
Well, that's actually a great question, one I've thought a lot about and I'm actually working on currently. So what I would say is you need the underpinning of comprehensive self-management. So all the things we've talked about, you have to get enough sleep, manage your stress, eat a diet which is comprised of actual food. I call it the real food diet. You can squabble over what kinds of food, but at the very least, it's got to be actual food. Manage things like pain, try to calm, the vagal stimulation is so important to calm the immune system because that's just using up untold amount of energy. So I look at that fundamental self-management. That's kind of what I teach and have taught for decades. But what I'm really excited about at the moment is understanding hormesis. And hormesis is when you purposely stress your system in a careful, small way. So just enough that our cells respond by upregulating or upgrading, let's say. This will fit perfectly with your theme. So, I think that's kind of what you're getting at. So, for example, intermittent fasting or time-restricted eating is a really powerful, beneficial stress. When we feel hungry, our cells don't like it that much. They're like, give me food. But they also decide, okay, I better prepare for, if this is going to happen often, I better prepare to manage this more easily in the future. And they produce more mitochondria and they activate AMPK and shut down mTOR and all of those things to upregulate metabolic health. So some of the things I've kind of looked into and I'm teaching are, so diet, time-restricted eating as being the easiest way and the most accessible. I think Dr. Habib, I'm pretty sure you're into fasting, so I'll just say more power to you. I'm not quite there.
JP is as well. It's not just me, but it's
okay.
something for sure.
Day fast yet. I think you have to do 3 days in order to really trigger autophagy. But the key is, for me, it's more exercise. I try to run.
So of course, exercise is huge. Now, unfortunately, for a lot of my community, they're super limited at the moment in how much exercise they can do. So I'm just like, move a little bit more, right? Try to just test and push your envelope a little bit, but please don't crash, because if you have post-exertional malaise, it holds you back. It's not a good experience. I'm really interested in heat and cold exposure. I'm traveling, and on my trip right now, I've been jumping in cold lakes when I've had the opportunity. I have a sauna at home that I've had for 25 years. So all of these things that are natural changes in our environment that our ancestors had to somehow cope with. Like in our ancestral days, we didn't always have food in the refrigerator. In fact, we didn't have refrigerators. So we ate a lot at certain times and went hungry at certain times. And my opinion is that our body has evolved to need these stressors to actually function optimally. Red light, so it's specifically with the mitochondria, red and infrared light therapy seems to be extremely beneficial, both because it helps the mitochondria produce more ATP, cellular energy, but it's also a hormetic stress. It causes a little bit of oxidative stress, and then the cells become turn on their NRF2 and other natural antioxidant pathways and upgrade them so that the cells can handle more stress in the future.
The way that I've been talking about hormesis a little bit lately with my clients is the more often we can teach our bodies to handle a little bit of stress, the more effective they become in handling higher levels of unexpected stress. And that ability to respond rather than react in a negative way with high levels of oxidative stress, high levels of chronic inflammatory activation, that idea is so important in teaching the body to be able to respond effectively. And this is exactly right. You mentioned the temperature therapies, right? The hot and the cold therapies, and even the idea of convenience of food in a refrigerator available all the time, the feast versus famine concept. One of the chapters in Upgrade Your Vagus Nerve that I did had a lot to do with this idea that we didn't live in temperature controlled areas for our entire lives, right? Like we were accustomed to having hotter days and colder nights, and you would seek out shade and you would seek out comfort, but now comfort is just available all the time. And we tend to be in this much more narrow band of temperatures, right? JP's in Florida right now. I'm sure it's near 100 degrees outside. And like even in Toronto here in the summertime, it gets up there, right? I had a day where it was hotter in Toronto than it was in Orlando just recently. But what did we do? We stayed indoors in air-conditioned spaces where we were avoiding these hot temperatures because it can be dangerous. And for some people, it can absolutely be dangerous. But if we can teach ourselves to handle that minor inconvenience of slightly higher temperatures, and our bodies are capable of handling it, then when these issues come up unexpectedly, our bodies respond in a much more favorable manner. And that's exactly what I think you're trying to get to, is what hormetic response does is it teaches your body to handle stressors effectively when they're unexpected. So the expected use of these things.
Yeah. And so that we can stay in a state of essential safety so that our brains can work optimally.
I love that.
And our metabolism and autophagy, meaning recycling, repairing and recycling molecules and cells that are broken or damaged.
Not to switch the topics, but I just wanted to get back to something else you talked about, which was the antioxidants, because of course mitochondria are the source of reactive oxygen species and free radicals in the cell. Now, at low levels, they're helpful. In fact, they're used as signaling molecules to signal between the nucleus and the mitochondria. But when you are constantly feeding the mitochondria, sort of force feeding them carbohydrates and sugars, you end up with an excessive amount of reactive oxygen species being produced, which is damaging. Now, the mitochondria and the cell have a variety of different antioxidants, but in truth, only two antioxidants actually work inside mitochondria. So yes, it's true. You have superoxide dismutase and perioxide redoxins and things like that that are working inside the cell. But inside the mitochondria itself, you only have glutathione and melatonin. And very interestingly, those two antioxidants are shut down by inflammation. And there's a reason for it from an evolutionary standpoint. If you think about it, if you're a cell and you're getting inflammatory signals, TNF-alpha and IL-1 you're being exposed to it by the immune system, well, then one of the things that might happen that you have to be prepared for is that there might be a microglial attack. You might have your cell infiltrated by a microbe or pathogen. So you want to make the interior of that cell as inhospitable as possible. And so what you want to do is you want to upregulate the production of those reactive oxygen species and not the antioxidants that are available. Now, your mitochondria can handle that for a short period of time. the way it happens, and it's really interesting, we've talked about it a few times, is tryptophan metabolism. So tryptophan metabolism, every cell in your body produces serotonin. Every cell in your body produces melatonin. It's not just the cells in your brain that are releasing serotonin or in your gut that are using serotonin for peristaltic motion. Serotonin is an intermediate to produce melatonin. And it comes originally from tryptophan. But when you're in this inflamed state, there's a shift away from the production of melatonin and serotonin and melatonin in the direction of producing kynurenine and a whole host of pro-free radical or free radical promoters, all the way down to quinolinic acid. And the upregulation of those is for a defensive purpose. There's a reason for it. But the consequence of that is that it damages your mitochondria over time. And if you live in a chronically inflamed state, like metabolic inflammation or constant stress, you end up degrading your mitochondria's ability to function, and you overexpress your reactive oxygen species to the point where it does damage to the mitochondria and to your DNA and other structures in your cell. So I'm a big believer that increasing your tryptophan levels and simultaneously reducing your exposure to stress and other things that would be pro-inflammatory are incredibly valuable to resuscitating your mitochondrial function. And I think it's almost anti-aging because it's reducing the effect of the reactive oxygen species on your epigenetic controls.
Wow, thanks. I didn't know that. And there's more and more coming out, right? Like every day I read a new paper, I'm like, wow.
No, it's
kind of
pretty
cool
wild.
Time to be alive.
It really is. It really, really is.
I'd love to hear a little bit about your experience working with clients and helping to create some of these positive changes that people want to create, these social habits, these positive influences. Let's get into what you do when you're working with a client and some of the changes you've been able to create.
So just for clarity, I'm actually retired. So
I know. I'm speaking about your past.
Every day.
I'm speaking about past.
I understand, but just for the listeners, right? Please don't email me. But you can email. So I've basically put everything I've learned online into some courses. So that's really how you could access this information if you resonate with it. So I've borrowed from Dr. Moskowitz and adapted a little bit. One of what I think is the core strategy to try to rewire the brain to think, feel, and act differently. And I've called it active redirection. And he's the one who clued me into when we experience a symptom, say pain, because that's what he was focused on. Normally, we have a habitual response, and it's something like a thought, oh, I can't believe this is happening again, an emotion, this sucks, or, feeling sad or angry or frustrated. And then an action, which is often withdrawal. Oh, I'm going to cancel my plans for the day. I'm going to put a cold compress. I'm going to sit in front of the TV and veg because I don't have enough energy or will to do anything else. So the goal is to use the symptom as an opportunity to right in that moment make a change, because that's when it's going to be the most powerful, right? When you're halfway down that path to your habitual habit and you decide, no, I remember there's a way out of this. I'm going to change right now, and I'm going to practice anything. And like the sky's the limit on the types of things you can do in that moment that make me feel good, connected, safe, calm, happy, content, like insert the adjective of your choice. So things that people would do in active redirection could involve things like self-talk. No, I know that chronic pain is caused by the brain, and I'm going to work on it right now to rewire a few of those synapses. Or you could phone a friend who's a very upbeat, positive person who's going to get your mind off it. You could go for a walk because that's positive for the body. You could do a meditation to calm your stress level. You could learn something. Okay, I'm studying French. I'm going to study it right now for half an hour because I want to keep my neurons busy learning something that's in keeping with my goals. And therefore, they won't have the capacity to keep firing pain. So the biology behind this, and I thought it was such a brilliant stroke of insight on Dr. Moskowitz's part, is that neurons, so each neuron in the brain, as I mentioned, is connected with 10,000 other neurons. So you might think, oh, they can do 10,000 things at once. Not true. They can only do one thing at a time. So if I keep many of my neurons busy in enough of my brain doing the things that I want them to be doing, they literally cannot, because of their biology, be firing up pain and other symptoms. So he calls it override. And it's amazing how fast. So most people, some people even within a couple days, but certainly within a couple weeks of practicing this about an hour a day, can shut down or significantly reduce their symptoms in the moment. Then if they keep practicing, and it doesn't have to be an hour a day altogether, right? You could do 3 minutes here, 2 minutes there, 1 minute there. If you have chronic pain, of course, it's impinging on your consciousness 1,000 times a day. So as many of those times as possible, use it as an opportunity to rewire in the minute by doing something that's incompatible with pain. There's 3 other legs that help support this practice. One is calm. So meditation, paced breathing, all of the things that you teach, Dr. Habib, extremely helpful because, again, this rewiring is going to work better. If you're in fight or flight, the brain's going to keep going, no, it really is danger, right? You're not getting it. Listen to me. I might have to make this pain bigger and stronger so that you pay attention to me. And then safety. Now, safety from the polyvagal theory often has to do with other people. It often has to do with social connection because people go, well, calm and safety aren't the same thing. They're not exactly the same. Calm is what I do myself, usually in the quiet of my bedroom or, living room or something like that, to slow my breathing, focus my thoughts, and make them more neutral and mindful. Safety is something I usually do by connecting to people who I love, who make me feel good about myself and help me feel safe, because it's easier in the world to feel safe if you got people on your team. And then the last leg of the support of this practice is to actually do stuff, right? To actually start doing your goals. So I've worked with people over the years who did hours of practice of different, and medical treatments and so forth during the day, and they never got any better. And finally, I figured out it's because they're not actually doing the things they want to do. So say you want to travel. Well, it's going to probably happen if you make sure, how are you going to travel? Do you need a plane ticket? Do you need a car? Do you need someone to go with? Do you need a hotel or a campground? So you have to actually start taking the steps, even if it's very slowly, to move towards the goal that you want. It won't happen by magic. And if you move slowly towards that goal, that's going to reinforce, you're going to go, oh, I have that reservation. I bought the tent. I found 3 friends to go with who are going to share the driving. All these kind of things are going to go, hey, life is looking up, right? That's going to elevate your mood. And I would say the collateral damage of doing neuroplasticity practice is a much, much better mood. So for me, I did neuroplasticity practice for my chemical sensitivity. That was my main symptom. I had really good response, but I kept practicing. That was 10 years ago. I still practice most days. And an unexpected, because I never really had depression or mental health issues, but I was like a very serious person who thought, life was filled with a lot of hard work. That's the message I got from my parents. And that's how I was going through life. And by creating in my imagination every day. Oh, so I didn't mention one of the common active redirections is to use the imagination. So maybe you're a housebound, very ill person and you can't go out for a walk. You can't paint, you can't get out of bed, but you still have access to your imagination. And a really interesting finding in research is that imagining yourself doing something activates about 80% of the neural pathways that would be activated if you actually did it. So they found this on people playing the piano and people shooting basketball, like free throws. I can never say that. And so I just tell people, you don't have to lift a finger. You just have to start imagining the life you want in all of its detailed and sensory glory. So I'm at the beach. I can feel the wind. I can smell whatever, the salt air. I see the people. I hear the seagulls. I'm eating the corn dog, maybe not the corn dog, but whatever, the more detail and senses you bring into that imaginary experience, the more neurons you're keeping busy and the less neural pathways are available to create symptoms.
You can do that simply by watching other people do it too.
Absolutely true.
Not just imagining. You could do. They've done studies looking at people playing tennis and then people watching tennis. In the same areas, the same circuits light up as if you were doing it yourself. So it is really, really important to, as you said, imagine it, or if you can't imagine it, at least watch it on a video or something.
I love this idea. Yeah.
You're kind of getting, JP, at maybe something called graded motor imagery. So there's kind of these steps towards progressing to something when you have pain. They study pain, but really it could apply to almost anything. So the first step, because some people, if they even imagine themselves going for a walk, they actually get pain. This is what really proves the brain is at the center of this, right? You're sitting there not doing anything. How could pain happen? It's because of the brain. So the first step in graded motor imagery is just to watch others until you're very comfortable and at ease with that. Then you start imagining yourself doing it. And when you're very comfortable and at ease with that, then you actually start, approaching incrementally the activity that you want to regain.
I wonder if
there's nothing more, there's no more powerful signal to your brain that you are healthy than if you can get upright and move. The moment you're doing that, your brain says, well, this is what I'm designed to do. I'm doing it, so I'm okay.
Yeah, I like that.
I think there's a lot of empowerment here for people to really know that, like, regardless of how bad your physical situation may be or your chronic health condition may be, that there is something that you can do to at least take a first step. If it's literally just watching something on a television or on a computer and then imagining or visualizing this concept. I want to ask a question here because it seems really connected. You mentioned imagination, and that imagination tends to be something that kids do very, very well. Children have, as I'm learning from my two girls, vivid and very intense imaginative capacity. And as we get a little older, that imagination or that ability to, not necessarily the ability, but the desire to go into an imaginative state tends to decrease significantly. We also have learned that safety signals that we've learned in childhood expand and continue on through our lives. And if we lack those safety signals early on, that can often result in psychological challenges down the road. Is there a link, or have you found a link between childhood stressors, childhood traumas, something along those lines that may have decreased the ability to imagine or to feel safe, then resulting down the road in these chronic conditions later in life?
Yeah, I'm going to be really careful with how I talk about that connection, though. So there's many studies showing a connection between what we call adverse childhood events, ACEs, and almost every condition you can think of in adulthood: mental health, physical health, autoimmune, like you name it. And these complex chronic diseases are no exception. There's several studies, very well done, showing, children that have been abused or neglected. There's a higher incidence of that in people with these diseases. But what I would say is those adverse childhood events have epigenetic effects. They turn on, you guys are nodding. Yeah, I'm sure you know all about this. So they turn on.
Yep.
Exactly. And they basically turn the switch on our stress response to on. And we can sustain that often for decades, right? Before the cumulative effect that you were talking about before kind of builds up, and all of a sudden some small event is the last straw and now we develop a chronic illness. So what I've found with neuroplasticity practice is that some people with a history of trauma are unable to progress. They're unable to do the practice because these messages are just like a fire alarm in their head saying, the world is not safe. Why are you spending time on this when you should be spending all your time on whatever the problem is? And so for those people, I say, you know what, go get professional counseling or trauma therapy to help you regulate your autonomic nervous system before you embark on neuroplastic practice, because you're just going to have way better success that way.
Yeah, this is where vagus nerve stimulation can be very powerful, because when you use vagus nerve stimulation directly on the nerve, you are overriding the conscious control. You're overriding the fear responses. You're literally going to the superhighway that is carrying those signals, and you are saying, no, you're going to carry the calm signal. And it's pretty remarkable. And I really can't emphasize enough that this is an area where I think it's most critical that it be used for people who are in that state and cannot get out of it.
Yeah.
They're stuck. This breaks it. It breaks the dam for so many different things. I remember we had Dr. Claronimos from the Northwest on, and he talked about a patient who was a fibromyalgia patient. And I know there's a lot of pollination between ME/CFS and fibromyalgia. Became completely dysregulated after 10 years of being really under remarkable control, lost it completely, associated with an inflammatory event. And the only thing that was able to re-regulate her and got about 70% better was using vagus nerve stimulation. And once that was in place, then all of the rest of the therapies that had been completely incapable of re-regulating her suddenly became effective again. So it's really important. Now, I do think that you're absolutely right, especially if the epigenetic changes have been so extreme that even vagus nerve stimulation can't override it. Then, I'm imagining that in the future, there will be opportunities to restore the epigenetic marks. And that's where I know you were talking about mTOR before and AMP kinase. Perhaps getting into Yamanaka factors and some of the things that are being discussed as anti-aging techniques that in their very first step, they restore the epigenetic marks. I wonder whether or not there's a role for those treatments, not just in anti-aging, but maybe in psychiatry, in managing patients who are stuck beyond the scope of anything that can be done other than literally going in and re-regulating those epigenetic pathways.
That's such a great idea. Like, I'm glad you brought up about using it in vagal nerve stimulation and trauma, because that was actually one of the questions I was bringing to today's conversation, because thinking it through and reading Navaz's book, I'm like, ooh, those people who are super stuck, it seems like that would be a really good use of that tool.
Yeah, I will say
I've seen it remarkably.
We've had numerous conversations with people that have utilized it in that exact way, and we're seeing even FDA clearances for PTSD and whatnot as well. So there are definite positive factors here, and I've often found that those patients that tend to plateau with the basic foundational exercise, the diet, lifestyle, all the changes, but they tend not to be able to just jump over that. Vagus nerve stimulation tends to be that kick, that notch that pushes them over the edge where they're able to actually make positive changes occur. So yeah, absolutely. It's one of those areas where the two can be utilized very well in conjunction with one another.
Yeah, that's quite exciting, because getting over that trauma hump is really difficult. I'm sure there's therapies out there that are very expensive and in-depth and long and arduous, and to have a bit of
something simple.
Yeah, something simple to just kind of hack that would be amazing.
You mentioned earlier the concept of strong emotions as being a major driver of neuroplasticity. Is there any way to kind of hack that? I wonder if there are particular emotions that we can utilize in a positive way to help to trigger more of those positive neuroplastic changes. Once we've started this active redirection process, and we're saying, okay, I'm going to do something different, but I need to almost enjoy that something different at a strong enough level in order to create that shift. Are there any strategies that you employ in there?
That's why children love to be scared. They love to go on roller coasters. They love to
that I don't understand.
Movies. They love to do things that shock their systems, because it's almost like electroconvulsive therapy. I mean, they get that shock of adrenaline and neurotransmitter explosion that resets them. It's a hormetic response, but I mean,
I guess it is. Yeah. I have to admit, I'm a scaredy cat. I don't go on scary rides. So how to elevate mood. So yes, there are a number of strategies. So for example, laughter yoga. So you go onto a laughter yoga, and there's like groups online you can join, usually for free, all over the world. So very easy and accessible. And I've done it a few times, and you start going, this is so stupid, right? And like, haha. But you continue for the length of the practice, and by the end you're laughing uproariously, and you leave, like, even though nothing amazing happened, you kind of created the experience of laughter and elevated mood. But nevertheless, all the same neurochemicals that would be released if something amazing happened are being released, right? Like you've both alluded to, the brain can't tell the difference. Was this a real happy event or one that you constructed? So we have a ton of control. So cute baby videos, funny cat videos, talking to friends who really uplift you, maybe have a daily phone call with someone where you tell each other a joke. That means you have to go online for like half an hour to find a really good joke to tell the friend. Right. So, anything you really love, pardon?
You can just reminisce also. And think about and imagine, much the same way we were talking about with using your imagination or watching something on television that is about walking or running, et cetera, can be really important for your healing process from that. The same thing is true for mood. You can simply just reminisce. Elderly people like to spend time reminiscing, because it's actually mood elevating for them. So it's just activating those pathways in your brain, and it doesn't have to be a new experience. It can be something simple as just recalling something that's really funny. I know from my own personal hack, there's 3 or 4 times in my adult life where I have been so overwhelmed by laughter as a result of banter with friends that I literally couldn't breathe. I was laughing so hard, tears were streaming down my cheeks. And it's generally something stupid that we're talking about. But just thinking about those things puts a smile on my face and elevates my mood. And that's all you need, is to have a few of those things that you can go back to and think about that even now still tickle me like silly. And it's very powerful and helpful.
Yeah, I couldn't agree more. So those are other examples of active redirection, right? Remembering something good that happened, doing a gratitude practice, which makes you search for all the good things in your life. Yeah.
I love that. I've always thought of laughter yoga as like a fake it till you make it type of scenario, but it works. Yes. And laughter overall. And JP, just with what you said there, it's this idea of reminisce, don't ruminate. It's like doing, we all have these moments where we say, hey, do you remember that time when blah, blah, blah happened? And we all broke out laughing. And ultimately you go into this positive experience again. It's this idea of reminisce, don't ruminate. Because if we're ruminating, we're often in this negative self-talk, breaking ourselves down further and further and creating a strong emotion in a negative direction, versus these reminiscing about positive life experiences that made us laugh or had us in a positive experience. And I like that as a shift in the opposite direction.
We've talked about this a few times, about the fact that the difference between the United States military and the British military. The United States military, a group of soldiers come back from an active, very dangerous, serious event, an encounter with the enemy, shooting, cetera. They come back. The very first thing they're done is sort of put into a pressure cooker, and they have to talk about it and do a debrief. Whereas in the British military, the very first thing they do is they go to the pub that's literally on the base, and they sit around and they drink and they talk. And inevitably the conversation doesn't go to what they've just been through. It goes to some, camaraderie that they've had with their, brothers in arms, and they have a lower incidence of PTSD and
wow.
other psychological problems, depression, etc., because they're allowing themselves to reminisce versus ruminate. And human beings, listen, we all have experienced it. Something bad happens in the morning and it can ruin your whole day because you keep coming back to it.
Yeah,
you keep thinking.
You have to tell everybody you meet. So that's actually another aspect of neuroplasticity practice. There's a book called Complaint-Free World. It's written by a pastor, and he says, try to take the 30-day complaint-free challenge. And it's actually very hard. So it took him 5 months to go 30 days without complaining. So a complaint is telling somebody a problem that they can't solve, right? As opposed to talking to someone about a problem that they can help you with. That's not a complaint, that's problem solving. So I kind of teach that, my course is many layered, but that's another teaching in there. If you catch yourself complaining or gossiping, actively redirect, because that's going to drag you back down to a danger state. And your brain's going to go, man, your life is so bad. We better maintain these symptoms at all cost.
It reminds me of that very funny video skit with the woman with the nail in her head, and she's there with her husband or boyfriend, and he's talking with her, and she keeps talking about the fact that she's got this vague pain in her forehead, and it's getting, all of her sweaters have snags in them, and it's all of the emotional baggage associated with the fact. And he keeps pointing, it's like, I think the problem might be that you have a nail in your head. And he keeps giving him a hard time about this. She doesn't want to solve the problem. He wants to ruminate.
She wants to complain about it.
Exactly. So
I'm going to have to watch that.
Is a good way to go. It's very funny.
Okay. So that might be something to watch. It's also good to reminisce about successes. Mm-hmm. So say you've become disempowered and you've lost your job or your relationship or whatever, all tied in with your health condition, and now you've lost your confidence. Very helpful to go back and reminisce about things that were successful that you did well at and felt a sense of accomplishment to bring back those pathways.
I really like that. It's this idea of ensuring that you're aware of your successes, ensuring that you can relive those in a positive way, and to help empower yourself in a very positive way. Self-empower yourself, I guess, is the way that I'm trying to get to it. I love this. This has been an awesome conversation. I really think there's a lot of practical approaches that people can take from this. Really, really empowering stuff, regardless if you're suffering from a chronic health condition, something that's held you back from being able to truly grow and move past chronic pain or major symptoms, or if you're just truly looking to improve your cognition, improve your neuroplasticity, really get your brain functioning in a really positive way. All of these tools can be utilized for both of these people. Everybody can create a better neuroplastic approach in their biochemistry and their brain, get their brain working better with a lot of these approaches. But I love this concept of reminiscing rather than ruminating, laughing and creating these positive responses, really digging down into the successes that you've had in the past and being proud of yourself and creating these positive, strong emotions that allow you to create this anabolic response in your brain, which builds up strong neuroplastic connections. This has been an awesome episode, and I think really practical for a lot of people. So thank you so much for all of these wonderful tidbits that people can take home. I want to give you a chance to kind of share some of the work that you're working on right now, your courses and your live work.
Oh, okay.
So just let us know where people can find you and can do a little bit of work with you if you're interested.
Great. Thank you for that opportunity. It's been a great conversation. I love when I learn some stuff as well. So probably the two things most relevant to this topic, I have a course called Healing Through Neuroplasticity. So everything we talked about today and much, much more, it's a very comprehensive self-study course. And for people that take the course, it's self-study. So of course we have no idea exactly how many hours they've spent on it, but become familiar with the information. We then offer live sessions for those people to try to help them put it into action. So we call that neuroplasticity in action. But you can't join NIA until you've taken the self-study. Otherwise, you won't know what to put into action or how to do it. So those are two offerings. And then for this, we got into this great discussion about the bigger context of anti-aging, or I'll call it longevity, and chronic illness in more general terms, and hormesis. And, what I've observed is many of the, just as JP was saying, many of the same strategies that are being used in the longevity field have a lot of value for people who are trying to improve their health, right? Health and aging are obviously intricately combined. So I've started live sessions with me. It's called Live with Dr. Stein every 2 weeks. So it's a membership. You get a session with me every 2 weeks. And that's the types of things I'm talking about, things like hormesis and how to improve health in an overall way. And I also have a monthly expert webinar, which you get free access to. Dr. Habib is going to be doing, I believe it's our October expert webinar, so you can hear much more about all these vagal nerve applications. So I would say those are the three main things that are most relevant. I also have a ton of free resources on my website, so you can go to the free resources tab. There's audios, videos, publications, lots there that would keep you busy probably for weeks to months.
I love it.
And we'll put the website in the notes, but do you just want to tell everybody what the website is? So
it's www.eleanorsteinmd.ca, and that's ELEANORSTEIN, MD as in medical doctor, .ca for Canada, not California.
Yeah. Thank you for spelling that out. This was wonderful. We will absolutely be sharing all of the links with everybody in the show notes.
Thank you.
And making sure that everybody is aware that you have this wonderful area of resources and a wonderful library that people can approach if they so choose to. So thank you so much for everything. JP, any final words on your side?
No, this was a wonderful conversation. I'm very happy to have had the opportunity to talk with you.
Yeah, it was great to meet meet you, JP, and of course, Navaz. We've talked in the past, and stimulating conversation I always enjoy. Thank you so much.
Wonderful. Well, thank you so much for joining us, for sharing your knowledge and these wonderful tidbits and great information for all of our listeners. For anybody who got to the end of this episode, thank you so much for listening. Please share this episode with one person that you think could use this information, somebody who's maybe having a challenging time with some anxiety or some mental health type issues, maybe chronic pain, maybe they're in need of some positive neuroplastic approach. Share this episode because it could change their life forever, and just get them going in the right direction. And ultimately, what we want is for everybody to upgrade their health. So thank you so much for joining and for listening, and have yourself a wonderful day. We'll catch you on the next one.